we could do is we could get Federico and Bernard to talk about innovation in neurosurgery or something like that.
But
So
Imad told he will not
Thank
be
you.
joining, that's why I
Yes.
was putting in.
Federico is here and Bernard is here as well.
Good.
Yes. So thank you so much for the amazing presentations. They are incredible masters. Do you hear me, please? Can you tell me?
Yeah, we can
Yeah,
hear.
very well, very well.
Yeah. So first of all, thank you for the invitation. This is an amazing event. I've seen incredible masters before me. I cannot add anything on what has been said. I only wanted to stress one point, which is related with the education. I've been asked to give a couple of comments, so I will go fast with some comment because we are delayed in the schedule. The biggest thing I see is that the incredible mastery that has been shared has to be now brought to a level that allow the new generations to access the training, meaning that we have different places. Any trainee around the globe has different opportunities, different masters, different days. So at the end of the residency, we are all different. So my perspective as a young neurosurgeon is that we need to find a way to, let's say, increase the safety for patients using simulation, using training in safe environments, and most important, to find objective metrics. So this is the panel I would like to encourage now. So about how can we measure skills in training. So this is my question to you. We are using augmented reality, we are using artificial intelligence and sensors in simulators, and we are trying to achieve a level of understanding of what happens in the tissue, in the ends. We are trying to find markers of abilities. And interestingly, I will share you very quickly a couple of slides, if I can, just to give you a better understanding of what I'm talking about. Please tell me if you see my screen.
Yeah.
So we are making a study. We made a study where we wanted to use a system based on artificial intelligence and sensors in simulators to analyze objective metrics. So we use these instruments to basically measure parameters. So we don't know what talent is. So we started measuring parameters in a computerized simulator. My disclosure, I am involved with Upsurgeon as a CEO and founder, not only as a neurosurgeon at the University of Milano Bicocca. So we basically use this system to see if a computerized system was able to distinguish between a young neurosurgeon and an expert, so with 10 years of experience. And interestingly, the system was able to compare the data of these two categories, and the result was incredible. So we had the ability to distinguish physical parameters to detect a difference in the way we were moving on, acting on a specific task. And this was quite interesting because, in my opinion, there is so many groups, universities, companies around the globe trying to achieve such similar results. And in my opinion, we need to join forces to achieve this kind of objective metrics.
Do we have time for me to make just a couple comments?
Yes, Bernard. Why?
Okay. First of all, it was such a pleasure to hear Dr. Toure, Dr. Morkos, Dr. Arnautovic, Dr. Basant Misra, really masters. Dr. Toure made a comment about the importance of visiting masters. And Dr. Sharif, what a beautiful program you and your colleagues have put on, because this is a good way to visit. On my Sunday morning, we can visit with masters. So we're doing what Dr. Toure advises. And I think the WFNS can be the platform with leaders like Dr. Borba and others in our current leadership to allow the whole world to be exposed to masters. Because the challenge 40 years ago was to go to a lab and learn the pterional craniotomy with Yassergil. You had to learn one way to do something. The challenge for the modern learner is we have to learn every approach. So the amount we have to learn or teach is much more than 20 years ago. As Dr. Borba said, we have to learn the traditional approaches, We have to learn the endoscopy. We have to learn what radiosurgery can and cannot do and should or shouldn't do. So the curriculum has become very broad, and we need more education. And I think of the concept like Massimo Bottura, who's usually the #1 chef in Modena, Italy, is a concept of tradition evolution, taking your grandmother's recipe, reinventing it without losing the great flavors, but keeping it new. Learn new techniques, but don't forget the simplicity and the beauty of the old techniques. And the smart current neurosurgeon knows how to integrate them. And that requires constant lab, constant learning. And I think the WFNS is a great platform to achieve that. Thank you.
May I say something?
Sure.
Yes.
Who? Kenna. You are older than me.
No, I just wanted to say how exciting I am and to see all these leaders in world neurosurgery, Ture, Borba, Marcos, Mishra, Bendok, Vukic, Sharif, so excited to share their experiences with the younger generation. And you see, they gave away their Sunday morning, their family time, because it's inside passion and innate wish to share the knowledge, to reciprocate, to discuss. And I think this is fantastic what Salman has organized, where we can meet and discuss. World Federation of Neurosurgery, you can see here, almost whole administrative council is here. And it's important to be with young generation. It's important to rub shoulders. It's important to discuss, show them, teach them, listen to their wishes, problems, and I'm looking forward for the next WFNS Congress in Dubai, where we can meet all of you and discuss further. So I don't want to take much time from Borba. He always has good educational tips.
Do you know? The World Federation of Neurosurgical Societies is not to make your life as a neurosurgeon better. It's to make the life of your people better. Because this is very important. It's very important to understand what's going on now in the whole world. In the way that this new team in the World Federation is working. We are a voluntary work. We pay our ticket to go to the meeting in Prague, to have any advantage. Now, with the new policy, the Federation, that the meetings start to be profitable, you can work, you can do the job. And this way, you'll be closer to you. We need to have thousands of centers of neurosurgery, but you need to give the facilities to them. Yesterday, I was looking at the global neurosurgery. That for me is the most important committee in the World Federation, because it's the real me of the Federation. But I'm asking and continue asking, what you leave to the country is important to us, to leave something to the country. Not only education, not go there, do a very nice course, 2-3 days, everybody happy, good food, good, and leave. Go there, do 3, 4, 5, 6 cases with very nice facilities. The company send you the drill, the best thing. Finish the surgery, put the drill under the arm and back. And the people is there. What you leave? This is the main goal in the next years of the Federation. Really work for the people. It's not easy to take somebody and send to US, send to Europe with scholarship, with very nice facilities, and come back home with nothing. I believe that these people today that is doing around the world a lot of charity and good work, but leave something to them. We need to be humble to understand this. Education improves a lot, but How can I say to the guy, use the endoscope, use the micro sugar, micro patapa? They have no drill, they have no craniotomy, he has no simple method. Let's work on it. Several projects that in the past was very active for short time. Now it's not more. You need to bring back. I remember 3 years ago, Professor Albefti, together with the neurosurgeon from Syria, talked with very proeminent and influent and billionaire neurosurgeon about to talk with the company to get a small microscope to this guy do microsurgery. Until now, there is no answer. We need less talk and more action. Bassan is doing, is making the whole, but now we need to act. We know what the patient has. We know the symptoms, we know the diagnosis, we know the treatment. Let's do it. And we can do it. The federation is the next meeting will be more profitable, have more money, and this money go to you. You not pay dinner, you not pay ticket, not pay anything. You do for you. It's my word, in the word of all this administration that is fighting for you. Sorry, I'm talking from my mind here. Sorry. Okay.
Excellent, Barbara.
Thank you.
Excellent.
Thank you.
Yes, Vernon, you were saying
I would ask that Federico print the cases of the masters so that we can do Dr. Morcos's M2 to PCA bypass on a model. Because the challenge with neurosurgery is we have rare, difficult cases. We need to improve learning curves. And how do we scale Dr. Morcos's and Dr. Toure and Dr. Borba? How do we scale?
Okay, I think, thank you, everybody. It was a very good discussion, and I think good thinking for future, and definitely, I'm sure you guys will work on that. Yeah.
I think you should allow them to people. I think the most important thing is to opinion of our leaders.
Sure.
See,
I
these
totally
people
agree.
need to talk. We need to solve. We have 200 people online here that's asking for hope. We need to give them something.
Sure, I totally agree. I think what you need to do is have a meeting, and then in that, let's make decisions. And depending on that, we go back to them and then explain to them where we're going.
Yeah.
That would be a good idea.
I vote for lots of hands-on workshops in Dubai.
Okay, we have